Halotestin is the most popular and recognized trade name for the enormously powerful anabolic androgenic steroid Fluoxymesterone. Derived from testosterone, halotestin is a structurally altered version of the primary male androgen. Simply put, it is the testosterone hormone with an added fluoride group at the 9th carbon position and an added hydroxyl group at the 11th position. The latter alteration inhibits the hormone from aromatizing, while both structural changes greatly enhance its androgenicity. Halotestin also possesses an added methyl group at the 17th position. This protects the hormone so that it can be administered orally. Brought to the market by Upjohn, halotestin carries an anabolic rating of 1900 and an androgenic rating of 850. These are powerful ratings indeed, and to give you an appreciation of such ratings, consider testosterone, which carries a rating of 100 in both categories. While powerful indeed, halotestin is not what we call an extremely safe anabolic steroid. Like most oral steroids, it belongs to the C17 alpha alkylated class, and while necessary to its oral survival, it also creates a hepatotoxic nature. The hepatic nature of a C17AA steroid varies from one to the next, but in the case of halotestin, we have one of the most liver-toxic steroids to ever exist. Use will necessarily be short-lived if liver health is to be maintained. Despite a massive anabolic rating, halotestin does not provide anabolic action anywhere close to what its rating would imply. Then translating anabolic activity is extremely low. This makes halotestin a relatively useless steroid for promoting increases in muscle tissue. When it comes to a bulking cycle, this steroid is absolutely useless. However, its androgenic power is nothing short of tremendous, making halotestin the premier anabolic steroid for promoting increases in strength. Not only will it promote strength, it will do so at a rate far beyond most any anabolic steroid, and it will do so rapidly. Such activity will also promote enhanced muscular definition and conditioning. When it comes to supplementation, halotestin is best for strength-minded athletes or for competitive bodybuilders shortly before a competition in order to present a harder physique on stage. For the hardening effect to be enjoyed, you will need to be extremely lean or it will not show through. Halotestin also possesses some strong therapeutic benefits. When first released, it was touted as being an excellent steroid for muscle and bone repair, as well as providing anti-catabolic relief due to overexposure to corticoid hormones. Over time, the steroid also proved extremely useful in treating male androgen deficiency and breast cancer in women. Currently, these are the only two approved uses of the medication in the U.S. However, due to its extreme hepatotoxicity, it is rarely prescribed. Halotestin does not aromatize. This makes issues such as gynecomastia and water retention no concern when using this steroid. When it comes to the side effects of halotestin, those of an androgenic nature will be the most pronounced. This steroid can promote acne and hair loss in those predisposed to male pattern baldness. As such a strong androgen, this is one of the few anabolic steroids that can legitimately increase aggression. Those who already possess negative aggression issues will need to avoid this steroid. The use of a 5-alpha reductase inhibitor such as finasteride can reduce some of the androgenic effects. However, more than likely not completely. An interesting side note, halotestin's androgenic power is so great, it is one of the only steroids that appears to significantly promote phallic enlargement. Halotestin, as alluded to early on, is extremely hepatic. Liver enzyme values will increase with the use of this steroid. In order to remain safe, total use must be limited to short durations of time, and use should not be attempted if the liver is unhealthy. Further, those who supplement must avoid alcohol consumption when using this steroid and should limit the use of all over-the-counter drugs to when only absolutely necessary. The use of a liver detoxification supplement is highly recommended once use is discontinued. It is also imperative no other C17 alpha alkylated steroids are being used when you use halotestin. Halotestin can also negatively affect cholesterol. It is imperative your cholesterol levels are proper before supplementation programs begin. During use, it is extremely important that your diet is cholesterol friendly, that you consume fish oils and perform adequate amounts of cardiovascular activity. As such a potent androgen, halotestin cannot be recommended to women on the basis of performance enhancement. This steroid carries an extremely large virilization rating and will almost assuredly result in related symptoms such as body hair growth, a deepening of the vocal cords, and clitoral enlargement. The only reason for any female to use this steroid is in specific breast cancer treatment plans. For the purpose of androgen replacement, halotestin doses will normally start at 20 mg per day and then decrease to 5 to 10 mg per day depending on patient need. Breast cancer doses typically carry a much broader range in dosing and are case-by-case dependent. For the performance-enhancing athlete, 20 mg to 40 mg per day is quite common. Most men will notice tremendous results from a 20 mg dosing and will find this is all the halotestin they need. 40 mg can be attempted, but you must recognize this greatly increases the risk of side effects. Regardless of the total dosing, this steroids should not be used for more than 4 weeks at a time. 2 weeks in some cases can be enough, such as the 2 weeks leading to a strength-related competition or bodybuilding contest. While halotestin remains popular on the basis of intrigue, it is only used by select segments of the performance population. This has caused the supply of the steroid to decrease tremendously over the years. If you want to buy halotestin, you may find you have a difficult task on your hands. Most suppliers do not carry this steroid. Very few underground labs make it, and the U.S. supply of this steroid is extremely limited. Fortunately, counterfeits rarely exist. If you do find halotestin, the odds are strong it will be all it's supposed to be. This does not mean counterfeits do not exist, but they are rare as there is no money to be made counterfeiting a somewhat rarely used anabolic steroid. For more information, please visit steroid.com, the world's most visited anabolic website.